Hi, my name is Hajer Amawi. I am a Daytona State nursing student, and today I will be talking about Parkinson's disease. I chose this topic because it relates closely to home for me. My grandfather has had Parkinson's disease for the last 8 years now, so I have been able to witness firsthand the progression, complications, and interventions needed to have a day-to-day life with Parkinson's disease. So what exactly is Parkinson's? Not a lot of people know what Parkinson's disease is, and yet it affects a great amount of our older population. So Parkinson's is basically a neurodegenerative disorder that affects predominantly dopamine-producing neurons in a specific area of the brain called substantia nigra. Symptoms generally develop very slowly over the years. Symptoms start gradually, sometimes starting with barely a noticeable tremor in one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. The Parkinson's Foundation states more than 10 million people worldwide are living with Parkinson's disease. Different people will experience a different number and combination of symptoms, which affect all aspects of daily life. Parkinson's disease does not directly cause morbidity. However, complications associated, such as falls and pneumonia, are often associated with death. So some history and origin of Parkinson's disease. Parkinson's is a condition that has been known about since ancient times. Parkinson's disease is named after an English doctor, James Parkinson, who first wrote about the condition in an essay on the shaking palsy in 1817. Much has been learned about the disease, yet much remains such a mystery. The symptoms are progressive and degenerative, and it is understood that a dopamine deficiency in the brain is the root of the matter, yet why this initially occurs is still very unclear. In most cases of Parkinson's, it is idiopathic, which means it is unknown. Most research points to combined factors. It is believed that there is a strong genetic element in about 30% of the cases. So my vulnerable population and culture, because so much is still unknown about the development of Parkinson's disease and why we get it, I'm going to focus my culture in America, and particularly some people that are at risk for Parkinson's disease's cognitive decline. Age is a huge factor. It is the biggest factor for developing Parkinson's. The average age of onset is 60. Gender. Men are more likely to develop Parkinson's disease than women. They actually have a 1.5 times more probability rate than women to develop Parkinson's disease. Genetics. Head trauma. We all know Muhammad Ali, the famous boxer. Well, he did suffer from Parkinson's disease later on in life, and research suggests that head trauma could be an implication to getting Parkinson's disease later on in life, but there is no 100% certainty that that causes the disease. Environmental causes. Medical experts believe that environmental causes may help trigger Parkinson's disease, such as exposure to farming chemicals like pesticides and herbicides, Vietnam-era exposure to Agent Orange, and working with heavy metals, detergents, and solvents have all been implicated and studied for a clearer link. Overall knowledge in the culture of Parkinson's disease is very low, and it can affect all cultures. Minorities have an increased risk for delayed diagnosis of Parkinson's disease, and minorities are also less likely to receive treatment, and that is unfortunately just due to the health disparities in this country. So this is the 5 stages of Parkinson's. It is a scale developed by Melvin Yahr and Margaret Hone in 1967 that just helps classify the level of Parkinson's disease and the progression. So 0 being no signs of the disease, and 5 needing a wheelchair or being bedridden unless assisted. Some signs and symptoms of Parkinson's. Because Parkinson's is a progressive neurodegenerative condition caused by insufficient amounts of chemical dopamine. Dopamine basically allows for fast, efficient, well-coordinated movements. Parkinson's disease has both motor and non-motor symptoms. There are 4 main symptoms of Parkinson's: tremor, bradykinesia, posture instability, and rigidity. However, there are many other symptoms too, such as loss of smell, which is actually an early indication for Parkinson's, impaired posture and balance, loss of automatic movement, such as blinking, smiling, or moving of arms, can experience speech and swallowing changes. Non-motor symptoms can be particularly debilitating. These can include fatigue, mood disorders such as depression and anxiety, constipation, sleep, and urinary problems, orthostatic hypotension, weight loss, problems with vision, cognitive changes, hallucinations, delusions, and pain. With so many variable symptoms, it's an extremely individual disease, which is why it's incredibly challenging to manage. So no two people present in exactly the same way with symptoms or disease progression. Some associated risks with Parkinson's, falls being at the very top of the list. Fall risk is a common secondary symptom of Parkinson's disease. The risk of falling starts increasing in stage 3 and greater in stage 4 and 5. In these stages, you might not be able to stand or walk on your own. Swallowing difficulties, breathing issues, having another serious long-term condition, dementia, greater risk of severe morbidity or mortality should they get COVID-19, which is, they have to be very careful during this time. Progression of Parkinson's. It is important to understand that people with PD first start experiencing symptoms later in the course of the disease because a significant amount of the substantia nigra neurons have already been lost or impaired. So it's very hard to detect Parkinson's early, and scientists are exploring ways to identify biomarkers for Parkinson's disease that can lead to earlier diagnosis and more tailored treatments to slow down the disease process. According to Parkinson's UK, Parkinson's is the fastest growing neurological condition in the world, and currently there is no cure. Some treatment for Parkinson's. Because there is no cure for Parkinson's, treatment focuses completely on managing symptoms, and levodopa was developed in the 1960s. It is considered a gold standard for the treatment of Parkinson's symptoms. Levodopa is in the class of medications called central nervous system agents. It works by being converted to dopamine in the brain. Timing of medication is crucial. Everyone with Parkinson's should exercise. And deep brain stimulation is a surgical option used to treat Parkinson's disease when medication is no longer controlling symptoms. However, not everyone is a candidate for this, and once again, it does not cure Parkinson's. So for my peer review article, I found one discussing nursing with Parkinson's patients and the interventions we take and how important it is. And I can attest to this because my grandfather actually has a home health nurse, and she assists him with all his day-to-day activities, and it is so essential. Home health nursing is preferred for Parkinson's patients. Parkinson's nurses will visit in their own homes, and they will provide individualized advice through personal assessment. Parkinson's patients are actually at high risk of a hospital admission, but by regular contact with their clients, Parkinson's nurses are able to identify risks and intervene early to prevent these crisis admissions. A multidisciplinary approach is needed to manage Parkinson's disease effectively. The work of Parkinson's nurses is extensive. They support the client and the family and cares by giving information to support to an agreed plan that promotes the best health and lifestyle. And they also work closely with other specialties and other healthcare professionals, and they advise and make referrals to such as speech and language therapy and occupational therapy. Some more culture and ethnicity within Parkinson's that I found interesting. Studies show common themes across various race and ethnicity about Parkinson's disease are fear, loss of independence, hopefulness for a cure, and worry about becoming a burden to the family. Unique themes were mistrust in the healthcare system and language as barriers to care among African Americans and Chinese, respectively. And lastly, Parkinson's in the community. I was so delighted to find that we have actually a wonderful community that supports Parkinson's disease here. The Parkinson's Association of Greater Daytona Beach has a website just identified for Parkinson's patients. They were created to assist those in the community who are affected by Parkinson's disease, and they're dedicated to enhancing and supporting and improving the lives of individuals and families affected by Parkinson's disease and other movement disorders in the Volusia-Flagler area. They provide high-quality, comprehensive resource programs and services, and they just do like weekly walks on their website. I saw that. They do a lot of community events, and once again, a great place for resources to get to know about Parkinson's and how to treat people with it. And that concludes my, my project on Parkinson's. Thank you.